Hi, today in this presentation, me and my friends Kadir and Yaren are going to talk about our project, which is Implantable Loop Recorder, which is also called ILR in short.
Implantable loop recorders are medical devices that allow a patient's heart rhythm to be monitored for approximately 2 years. In this report, we explore the design, function, and clinical application of ILR in medical mechatronics and seek to innovate for advancements. Specification of device. Firstly, device purpose. The ILR device is designed to continuously monitor and record a patient's heart rhythm. Secondly, device warnings. The ALR device can be placed into the body with approximately 10 minutes of surgery for implementation. Targeted patient. It's designed for patients with palpitation or a known history of arrhythmias and requiring long-term monitoring. Medical condition diagnosis. Help diagnose heart condition. Provides data to manage a patient treatment plan. The unique device identifier system is used to facilitate the tracking and monitoring of medical devices as well as to help with recollection safety alerts. As a Class 3 device is considered a high-risk medical device that requires a rigorous evaluation of its safety and performance before it can be marketed and sold in European Union. On the figure, for example, you see how to least make contact with the heart. These show the CA marking routes. CA indicates that products sold within the community have been inspected according to minimum safety, health, and environment protection requirements. The device is surgically implemented in the chest, close to the heart, and designed continuously record ECG data for up to 3 years when it detects abnormal heart rhythms. The mode of action of the ILR is to provide long-term monitoring of the heart electrical activity to aid in the diagnosis and management of various cardiac conditions. In the overview of a raw material table, we see that is examined according to component location and material. It comes into direct contact with the human body, so the highest biocompatibility standards are taken into account and is made of titanium. The tips of the device are made of flexible and biocompatible material that ensure ease of implementation and long-term use without causing any erosion or damage to heart tissue.
Here we see the previous generation of the device by manufacturer, the version date and version number. And this is a similar generation of the device in European Union, Mechatronics, it's from Germany. And this is the quality manual system chart. Here we see the scope of QMS, list of procedures comprising the QMS, and description of interaction of QMS, and outline of QMS. So we are looking at these. Here in the traceability, we see a diagram showing the steps of the device from directly beginning till the end, corresponding to the step of ordering the raw material and to the patient. Here we see the labeling document of our device. On the document we see a bunch of symbols which have their own explanations and properties with their must. And we also prepared an instruction for use document. Here we have many information regarding to our device. For the description of the design process, this is how we manage the design process. We can see in the steps, like the design process began with the conceptualization phase, where the basic idea for the device was conceived and a feasibility study was conducted, and it goes like that. And the design inputs, I guess this is the most important part of the template for each. Like for example, for functional, the device must record and store ECG data for at least 3 years, and for performance, the device must have a minimum storage capacity of 2 GB for recorded ECG data. And it goes like that for usability and regularity and safety. Design outputs of our device, of course we know that we don't have any physical outputs for now, but we wrote symbolically the outputs of our devices, like hardware design drawings and specifications, or bill of materials, or circuit diagrams and schematics, and electrical and mechanical testing reports. So these are our design outputs. And for description of manufacturing, we see from beginning, like order the raw material until the release part. In controlled certain manufacturing steps, as we showed in the chart before this slide, we can also see here like the steps: raw material inspection, component assembly, sterilization process, and testing and calibration, quality assurance checks, and documentation and traceability, and lastly environmental control. And here in this slide we see some steps. These steps are used for the quality control in the process of our device. For general safety and performance requirements, here we see some titles like electrical safety, biocompatibility, and goes like that, and for other explanations for other titles.
This is the risk analysis table. For improbable and critical, we can give that example, such as highly improbable occurrence of device malfunction leading to patient harm. This is the risk management table. For the previous example, which is highly improbable occurrence of device malfunction leading to patient, the solution is design the device with building in fail-safe mechanism to ensure patient safety. Verification. Verification consists of functional verification, performance verification, usability verification, regulatory verification, safety verification, and environmental verification. Validation. Validation activities. The following validation activities were performed: simulated testing, clinical studies, user feedbacks. The validation results were analyzed and ILR device demonstrated successful performance and compliance with the acceptance criteria. In conclusion, the successful development and validation of the Starion ILR device demonstrate our dedication to excellence, innovation, and enhancing healthcare. This is the references. Thank you for listening.